Welcome to the 10th episode of Legal Affairs. I am Lawrence Ma. Hong Kong was hard hit by Omicron since the beginning of 2022. Being a dense city, the Omicron virus spread widely and rapidly, but our oldest and most vulnerable residents were also largely unvaccinated. In March, the Wall Street Journal published an article with the heading, quote, Hong Kong's COVID-19 death rate is the world's highest because of unvaccinated elderly, unquote. Some said it was because the government did not push it hard enough. Some criticized social workers managing aged people's home themselves did not believe in vaccination, so refused to help the elderly to get their jabs. And some said that these elderly's children refused to sign the consent forms for their parents in fear of any unknown side effect that vaccination might have. Now in the studio today, we have Dr. Vitus Lang, who is an election committee member of the Medical and Health Services sector and consultant of the Hong Kong Legal Exchange Foundation. Dr. Lang is a Deputy Commissioner of Auxiliary Medical Service, and he is a chairman and a member of a number of hospital governing committees. He helps to manage many hospitals here. Now, Dr. Lang, what do you think is the main reason why there are so many elderly deaths by Omicron?
Well, perhaps we go back to the past 2 months, from February to March. That's the time that when we have a sharp increase in death rate and also the number of infected people in Hong Kong. During that time, the elderly homes were starting to have high number of infected cases. That is actually caused by those staff. They infected the elderly and then they cross-infect each other within the elderly home. During that time, it was very chaotic because when we are having a long queue of people waiting outside A&E departments of HA hospitals, and also the shortage of staff within elderly homes, so that the elderly within the elderly homes having no people to take care of them, not enough staff, not enough nurses, not enough caretakers. That is the situation that caused the whole matter sort of increase. I mean, the whole situation is simply under control during that period of time. However, that sort of chaotic situation is not the major reason. The primary reason is because that the elderly are not vaccinated. So this is the major reason.
So is it because of the side effect they worry about, or is that because the person who take care of them, the social workers who take care of them, do not believe in vaccination will cure the disease?
Well, social workers is only a small portion within the elderly homes. I think the promotion during that time wasn't enough, and also the misconception of the social worker and also some medical health workers as well. They thought that the side effects will cause problem to the elders, and there are people saying that the vaccines are not for people with long-term illness and also not really from high age elders. So that was the situation at that time.
Do many of these Western countries also have this worry that there might be side effects to the vaccine?
Well, that's a very good question. We have some friends from UK, say. They were the major group of people carrying out the vaccination program for people in UK. So one of them told us that his first person to vaccinate was a lady in his age of 106. So this is totally different mentality. So you can see that even they have a high rate of infected people, but I mean the death rate among the elders actually quite low.
In Western countries.
Yeah, in Western countries. Yeah.
So I'm not sure whether it's because of the Hong Kong people are not used to trusting the government and anything that's proposed by the government. So as long as anything that comes from the government, they would have a second thought about it. That may be a reason, isn't it?
That is also a reason among some of the medical people or the healthcare people.
I understand that you have today prepared some charts and figures. Do you want to share with us the charts and figures that you have? I can hold
Yes, this is the information from the CHP.
Right.
The first graph I want to show is the graph showing the distribution of the deaf people from the infections. You can see that the red represents those unvaccinated. You can see that those are distributed among the elder in older age distribution. And also you can see that the large number goes to the unvaccinated people. The large number of deaths will be among the unvaccinated people. This is another graph showing the black color means those has passed away. This is the 80 plus line. You can see that 10% of those who pass away are within this area.
So, according to figures, that Hong Kong's elderly death is the highest probably amongst the world, which is pretty sad. Now, Dr. Leung, in light of so many elderly die unvaccinated, why can't the government introduce a compulsory vaccination scheme to compel people to get vaccinated?
Well, you and I are lawyers. We should know that if we try to inject somebody else with something without his consent, that would be an assault, or even causing bodily harm. That would be a criminal act. So we have to be very careful about enacting something new law to allow compulsory vaccination. So that is something that we have to think about.
That's true, because as far as we understand, there are no compulsory scheme worldwide. Because the world,
exactly.
Even in other countries, they don't compel people to vaccinate.
That's right.
Maybe because that's really an intrusion of the body.
Right.
And if there are any injury or death resulting from that compulsory act, the government would be criminally responsible. Because, of course, I mean, there are so many research and actual results showing that many of the deaths were not caused by the vaccination. They were deaths because they didn't get vaccinated.
That's right.
But there are research saying that many of the vaccinations would not cause the death. And those people die after vaccination was really because of their inherent or intrinsic health conditions.
That's correct.
So, okay. Now, can you tell us more about the current government measures that to encourage people to get vaccinated in Hong Kong?
Well, I think the government is doing it in a very right or correct direction because they are creating some kind of vaccination bubbles. That's very good because, say, for example, we lawyers, if we are not vaccinated, we can't go to court. We can't carry out our job. So these vaccination bubbles has covered like restaurants, government buildings, and things like that. If they can increase that to cover hospitals, then all the elders will go and get vaccination, I believe.
So you're saying that because of course, there are people who are now very concerned, particularly with Omicron, because it's so rapidly spread. It is so easy to get contracted with that. People are, have been in a rush to get vaccinated, including the elderly, right? So that's why the injection rate in Hong Kong is pretty high.
Very high, eventually now. Yes, very good. Except that it is still on the low side for elderly and also the youngest group.
Do you think that any extra can be done to encourage elderly vaccination, in your view? I
think the promotion and education for the whole Hong Kong is very important. As you said, some group of people, they simply shut their own mind. I think they have to be better educated.
The elderly, many of the elderly, they do not use, like for example, the mobile phones that we have. We are digital, so we have smartphones. Some of the elderly do not get smartphones, and some of them don't even watch TV. It is very much so you need to do it by way of person-to-person sort of persuasion.
Yeah.
So do you think that the government should conduct more sort of aged people's home visit and elderly visit by social workers so that they would be able to go and encourage those elderly?
I think the whole process has to be through these NGOs and the volunteers because they are the workforce already being in touch with the elders. So as you mentioned, it's a very good suggestion that the social worker has to do the job.
Of course, we don't have that many government health workers employed by the government to do this mass scale sort of person-to-person persuasion. We need to rely on NGOs and we need to rely on social workers to do that. And advertising obviously may not be that effective because they don't watch TV, they don't have a smartphone to see those advertisements. And you have to answer their questions sometimes to whenever they have a question. Then about doubts about the vaccine, you have to actually talk them through,
yes,
to persuade them.
Yeah.
I think that's something that what the government should be doing all along. Someone said that the golden opportunity has gone, and therefore we have so many elderly deaths. Maybe the upcoming new administration may be able to do better in relation to elderly vaccination. Yeah. Well, thank you, Dr. Lam. This is Legal Affairs, and this is the episode for today. Thank you for watching us. See you next time.